Hi, today I'm going to be doing a PowerPoint case presentation for 594, Dr. Healy, pediatric illness. Today I'm going to talk to you about constipation. Constipation may be occasional, infrequent bowel movements. It's where you have difficulty passing stools that persist for 7 weeks and having fewer than 3 bowel movements a week. Sometimes people experience constipation short term, and sometimes people experience constipation long term. And we do not want to overlook this in our pediatric community. Some kids may present with no problem. Some kids they have normal bowel movements up to 2 or 3 times a day, where you might have others who are having a hard time going just the one time a day. Even when they're drinking just milk as little bitty infants, you have to be careful that they don't have some kind of underlying illnesses that can be causing the constipation when they're that young. I know some of the problems that you can develop as a child when you're having constipation can be Hirschsprung's disease, can be one of the cause of constipation or the inability to have a bowel movement, period. It's just where the nerves that controls the muscles inside the colon does not work to allow peristalsis. That's the movement of the bowels through the colon. So we kind of want to know when taking care of this community what are the symptoms of constipation or just what constipation is, period. Constipation is a common problem in children who does not drink enough water. Also, who does not eat fruit. I know I have a niece who never liked fruit. She, to this day, she's grown up and she do not like fruit. And also, we have kids who are just couch potatoes, that do not get around. They like to stay in the house and look at TV, or they like to stay on their computers. They also like to play video games. It's just not very active once they're in the house. And um, if you notice, I list a few of them, and sometimes taking certain medications, including some antidepressants, can cause constipation. Um, Having a family history of constipation can cause, is one of the common problems associated with children. But we do want to make sure that we are giving them enough fluid to drink. I know they say water is good, but what do you do when you've already given them enough water and they're still not going? And they don't like fruit. So that's when you're gonna probably consult with the physician, have them consult with you as a provider, the nurse practitioner. We have to kind of, I know they have new and improved vitamins over the counter. I used to have to give them to my son who had problems with his bowels as a kid. Um, they fiber chewables. They just think they're getting a treat. They don't know it's fiber to help with their bowels. They just feel like, oh, mommy gave me a piece of gummy worm, and that's exactly what it tastes like because I tasted it myself to make sure that he would take it. And that's something that we could use to help get enough fiber in their system. I know I mentioned in the previous slide that just describing what constipation is, but I also wanted to mention the symptoms because sometimes we forget about the simple things that could help diagnose a patient quickly, and understanding what the symptoms of constipation is would help us in the long term. I already mentioned less than 3 bowel movements a week. Um, Sometimes the parent may come in and say, my child has not had a bowel movement, or do not go every day, even though it may be normal for some people, but we don't want to just ignore it. You know, Sometimes they may say that they're having a hard time going. Um, And sometimes they may say that the child is complaining of abdominal pain, or they're hurting while they're trying to have a bowel movement. If a parent come in and say that my baby, whenever he or she is having a bowel movement, he just screams or she just screams, we need to, evaluate that and make sure that their little bellies are digesting and working properly to get this waste out of the system. Also, I put down there just simple things that you can instruct the parent, to look out for, like traces of liquid or clay-like stool in the child's underwear, because that is a sign that the stool is backing up in the rectum, and also on the surface of the hard stool. And when we're assessing these babies and these small kids, just sometimes you just may have to do a rectal exam just to make sure you don't see anything. But I just wanted to mention the symptoms here. And if you notice up there in the right hand corner, I just thought I'd put those little underwear up there I found that picture and just really liked it, and like, to help explain this slide right here. So what do we tell parents when they come in and say, what is causing my child constipation? They were fine until they started going to school. Well, here I put a slide in to help assist in explaining this to the family. Withholding or by ignoring the urge can cause constipation. Changes in diet, changes in routine as they start school. Cow's milk allergy. A lot of times you don't know if a child has a milk allergy to cow milk. Sometimes we give it to them at home, but if they're going to school every day and they're drinking the milk, that's that can increase their chances of having constipation. As I mentioned earlier, my son, when he was younger, we went through this and we didn't realize that he was having problems until he got where he was actually vomiting. And we took him to the doctor and they did an x-ray and said that he was backed up with stool. And at that time, I knew that I had to um, stop allowing him to drink so much milk. So some days I would send him a juice. Some days I would send him a water. Some days I would send him a Capri Sun. And also let the teachers know that if your child has to go to the bathroom, they should be allowed to go. I know they are trying to train them to sit and follow rules in school, but this is still a very vulnerable age, and they still are trying to learn and get used to changes that's going on within their bodies. Also, if they have a medical condition, an underlying medical condition, that's why it's best to do a full workup when a child's coming into the office regularly complaining about constipation, or the family's complaining about constipation or stomach pain. You just kind of just kind of have to just go in and just say, hey, let's just check this out fully to make sure that we're covering all the bases. A lot of times, parents are confused on when to bring their child to the doctor's office when they're having abdomen pain or discomfort. And so we want to be able to provide them with the proper education. I know a lot of times we will families consult with each other. If they have a grandmother or aunt that's older, they will consult with them, you know, and then finally, when things don't get better, they'll come into the doctor's office. So uh, the child should see the doctor if they're having a fever, if they're vomiting, if there's blood in the stool, abdominal swelling, weight loss, painful tears in the skin around the anus. And that's what I was saying about checking. We want to make sure that they're not having problems in that area. Intestinal protrusion out of the anus. A little kid should not be having hemorrhoids or um, problems in that magnitude unless something is going wrong. And not eating. A lot of times if they're having abdominal pain, they're not going to eat. If they're not going to eat, sometimes they don't drink, which could cause other problems such as dehydration. So We want to advise the patients as they're coming into the office. These are some things you need to look at, especially when they're newborns. Some special first-time mothers, they need to know when a baby needs to have their first bowel movement. Each time they need to know when they need to have a bowel movement. They shouldn't be going all day with no bowel movements, or 2 or 3 days with no bowel movement and still drinking their formula. They shouldn't be vomiting every bottle they take in. There's something wrong. So the first time mothers, we really need to make sure they understand what to look for, and just in case that their babies develop constipation. So, as a provider, how are we going to diagnose these patients with constipation? How do we know if they hadn't just ate something bad at that one time and just have an upset stomach? How do we know that what we're seeing, or what we think we are going on? How are we going to confirm that? Sometimes we can't go just on the parent information alone. We want to make sure that we have evidence to back us up, especially with someone so small. We're going to be treating them. We want to make sure we have evidence to back them up. Of course, we're going to get a complete medical history. We might ask the parent about the child's diet and physical activities. Also, I mentioned this earlier, you got to check that child's anus to make sure that there's no blood, and to also make sure there's no stool in the rectum. And you can test the stool, abdominal x-ray. That's how they confirmed my son's problem. They did an x-ray and showed that he had a lot of stool in his colon. And it's good to have an x-ray anyways, especially if they're vomiting, because you want to make sure they don't have a blockage. It wouldn't do any good to give them a laxative that they cannot get down, uh, and it won't go around the blockage to just cause more problems. Also, you see they got an anorectal motility test, a rectal biopsy, and that's just for those children who just keep having problems. Um, Blood tests, of course, occasionally blood tests such as a thyroid panel to make sure that their thyroids are working properly. That's part of the metabolism. You want to make sure they're able to metabolize and they're working, that everything is working properly for them. Your child, you as the provider will analyze the way the markers move through your child's digestive system. This is just kind of explaining to the family if you have to do a transit study or a marker test. These are some of the tests that we can do, and it tells us how to explain it to the parent. Let's talk about the treatment. We already mentioned earlier that doing exercising and drinking enough water, adding fiber to the diet, fruit to the diet could help with the bowel movements. But just say that the family is doing everything we have asked. We didn't run all the tests. It has confirmed that they do not have an underlying condition. Um, they didn't have thyroid problems, and they're still not working. The bowels are still not going as they need to. Because if a child is not, bowels are not able to move, it can cause poor energy, lethargy. They can become lethargic because they just don't have enough energy to get this. They're not cleaning their system. Their systems are very vulnerable at this, early in life. And if they're in pain all the time, they're not going to want to eat, so it's going to cause them to be dehydrated and cause more problems. So, we want to make sure that we give them a proper treatment. Over the counter fiber supplements or stool softeners, a laxative or enema. And in certain instances, they have to be hospitalized, and given hospital enemas. But we want to prevent that. So we want to kind of make sure that we are putting them on those supplements or stool softeners. And we have to make sure that we're instructing the parent that if they develop diarrhea, we need to let us know, because diarrhea is the opposite of constipation. and giving stool softeners, fiber can cause diarrhea. And then you have another problem. So we're just going to have to, work as a team with the family and with the parents to make sure that we have a fine tune and put this in the history and physical, and let the family know they may outgrow this and they may not. So it's something that they want to make sure is following that person, that child, even into school. They need to know that this child have a condition. And we may as the provider have to write a doctor excuse for that child to be able to go when they have to go. A lot of times when they're playing or when they're in school, they don't really want to go, especially as they get older. They don't want people to know that's what they're doing in the bathroom. But we have to make sure that they know that's part of how we're made, and we want to be supportive to them and helping them, stay healthy. Also, continue with the treatment that you may have to offer a one-on-one counseling session for the family members who's going to be involved in taking care of the child. Because a lot of times we parents have a tendency to say, "Oh, he just had a little upset stomach," or "Oh, the doctor said he has constipation." We really have to enforce that this can really lead to a serious problems. So sometimes you may have to have a class with the family to let them know, okay, this is how we need to do this. Lifestyle and home remedies, alternative medicines, high fiber diet, adequate fluids, adequate time for bowel movements, and to be supportive. And I remember when my daughter was born, I was told that she had asthma, and we took her to a chiropractor. She was about 3 months old, and for some reason they had a regimen that they can work with her at 3 months old, and to this day um, she do not have any asthma. I don't know if that what it was that helped, but we didn't have any more problems after that. So sometimes a massage for them may be better. We could teach the family members how to do it. We don't want to take them to a studio. I know some family members, parents are really particular about somebody touching their child. So having them go to a massage class to learn just the basic techniques could help with the bowel movements, and teaching them how to put gentle movements on the abdomen to help with uh, peristalsis. Okay, in conclusion, we want to make sure we understand as the provider what is constipation, learn the signs and symptoms so we can get the adequate treatment, and instruct the family on the causes of constipation and preventative, and come up with a treatment plan with the family members involved. If they are working parents, they're busy. Sometimes they're up at 5, and sometimes they don't go to bed till 10 o'clock at night. So we have to have a plan designed to fit their regimen, or also the child regimen. I know they do have school nurses. Sometimes you can send the medicine, and the school nurse will give them the medicine throughout the day if they need it. Also, run tests to rule out other conditions, such as allergies. We know that allergies to milk. Also, evaluate if they're on any other medicines, if they have thyroid issues. If they are on medicine, learn what they're taking that medicine for, if it can be changed. Learn the side effects. If the side effects are greater than um, fixing the problem, is there something else that we can get them prescribed to? And if all else fail, refer to the GI specialist. You know, we don't look bad if we refer. We look better if we refer and the problem is fixed. So, this is the end of my PowerPoint. I hope I was able to help provide some information on constipation. It does affect different communities, and we cannot leave out the pediatric community when it comes down to this condition. We want to make sure that they are being well taken care of and that they are growing at the proper rate that they're supposed to grow, able to eat the proper nutrition without having any complications. Thank you.